8 o'clock. So how are you? Thanks for the time. Thank you for agreeing with this very brief interview. I mean, I'm not a host of anything of any sorts, and but you know, we had this idea a while back, and maybe we can talk to people that we know and try to bring something different. You know, just to have a very nice and relaxed chat.
Yeah.
And trying to get different points of view, because you know me, I'm always trying to piss people off initially, and then eventually, you know, break that the first impression is the most important one. No, forget about the first impression. Let's get the second, the third one, the fourth one, and on the long run. So that's what I believe in. So we met in 2017, 16, 17, was it?
Yes, in Israel.
Wow, it's been a while. And all I knew from you is basically that you trained Krav Maga. That was it. Happy with that. Saw your performance there, you know, at the grading of that day. It was like, whoa, okay, you know what you're doing. And, oh, come on, don't be like that. But then later on, years later, actually, I realized that you actually had a PhD, or you just finished your PhD in clinical psychology. Is that correct?
Yeah, I had finished before Israel.
Okay. Wow. And then, so your initial degree is psychology, and then you must have gone, I don't know exactly how does it work, but normally it's a degree, a master's, and then eventually a PhD. Or sometimes people go straight for the...
Yeah, and well, I can speak for the United States. So you get your bachelor's, and I ended up getting my bachelor's in psychology. And then I had started a master's, realized I wanted to go straight into the doctorate program. And so I just switched kind of mid-year from a master's to a doctorate. But when you get a doctorate in the United States, a master's is kind of incled in there.
Comes the package. It's like in Israel, when you buy the big falafel, you get the chips for free, yeah? I get it.
You would know, you ate all that stuff. I don't know.
Excellent. Well, fantastic. So can we, normally when I start with a conversation, as we discussed yesterday, we, you know, ask a little bit over the personal life, the martial arts or Krav Maga or whatever martial arts that you started with. And then we talk about your field of expertise, which in this case would be, you know, whatever you want to discuss regarding that. I've got a few questions, and I'm sure this bunch of people watching us here will be asking questions too, if you're okay with that. So,
yeah, absolutely.
So tell us about your martial art background then.
My martial art background, probably compared to some of the people you've talked to, is very, very short. By the time I had gotten to Israel, I was kind of a forever blue belt. I just didn't test very often.
Forever blue belt, yes.
I started Krav Maga in 2012 in it was the first or second year of my doctorate program. I was in Washington, D.C. at the time. Okay. And I had just moved from Chicago, so I was in a lot of unsafe neighborhoods where I was working in training, and I had been interested in Krav for years and years, but just moving around, I couldn't find a close enough one. It's too expensive on a graduate student's budget. Just wasn't working. And then by the time I got to the Washington, D.C. area, I was in so many dangerous, unsafe scenarios with work, and where I was walking around, taking the metro, that I said, I got to start taking classes. This is not good. Wow. So I found a gym, and I started, and it became a really good outlet for me too, just from the stress and exhaustion of grad school. I got to go in and spar and hit things and learn really cool stuff. People,
yeah. Hit people is good. It gets the stress very quickly. Makes you relax like nothing else.
Right.
And that was Krav Maga with Krav Maga Universal already, or it was a different organization back then?
No, I actually had not worked with KMU until Israel. That's when I met Ernie.
Oh, really? Okay.
Yeah. The only person I knew in Israel was Jeanette.
Yeah.
She was the only person I knew there at the time. Everybody else was a new friend, I guess.
It was interesting because I was under the impression that everybody knew everybody there. This is why I was joking with people. They look at one another like, who's this guy? I was like, I thought you guys were friends. I said, no, we never met. They live here in the US. I live here, which is like, 5 days driving or something. I was like, oh, okay then.
Yeah. So yeah, when it came to Krav, you know, I was a student and got to know some instructors pretty well. So I ended up, there were some weekends where I'm exhausted from practicum and studying and dissertation and all the nerdy stuff. And they would have an instructor's course over the weekend. And I would just kind of go, I'll be an extra body to help you guys even up the numbers. And that was my mistake because I basically got pushed into being an instructor before I was ready.
Well, it's the different ways of learning. You can learn in a nice way or in a pressure way, as you know it.
Yes.
Oh, that's very nice.
Yeah, I did a lot of training. I did a lot of instructing. I actually learned a lot of what I know now from just being forced to teach people.
Okay.
And I kind of bounced around a little bit. I had some interesting guidance from instructors early in my Krav background. I'll leave it at that. So I wasn't really with one organization for very long. And then by the time I got to Israel and after, it was Israel with Wingate, and then I worked with Ernie in KMU for my brown belt last year.
Right.
So,
okay. You did.
Yeah.
That's good. That's nice. Yeah. I said, Ernie travels all over the U.S. I mean, sometimes I see him, I used to see him in different places. I think, man, you travel, huh? He goes everywhere. It's very nice.
Yeah.
Okay.
Mm-hmm.
And regarding, talking about psychology, because one of the biggest things that I have from the classes, apart from being an older guy now and start looking at people and say, I think I know what you want, or, trying to measure people and trying to understand the guy's here, not for the Krav Maga, he's here because he needs to talk to somebody, or the guy came here because he likes the t-shirt and we teach around the corner, but the self-defense is the last thing that is interested. We had a lot of that. And I guess having a degree in psychology and working with people like that, you can also get to understand people and pretty much know what to say, when to say, or sometimes forget about the training, let's sit down and talk, which perhaps is the best part of the whole thing. Do you agree with that? Have you noticed, or have you been through any kind of situation like that during your teaching time?
So when it came to teaching, well, in particular, being a female, I think naturally the females in class would be drawn to my side of the room because they would see these big beastie men and they wanted no part of it. So they would kind of navigate towards my side of the room. So there was just that familiarity and comfort level so that they could even get started without starting being so held back. And I think that was one of the things I experienced the most, was kind of, for better or worse, being utilized to draw women into classes.
Very
so
interesting.
Yeah.
Because one of the things that I've noticed, right, many years ago when we started this females only class on a Saturday in a certain time, is that we had a male instructor, which was me basically teaching the classes there. But the rhythm between the normal class, the regular class, even where the girls were training, and then the females only class was very different. So first of all, nothing of this running around doing push-ups, sit-ups, and squats. No. Let's work with one technique. We want to see that one. Okay, that one. So it's a different level of, how can I put this way? The dynamic was slightly different.
Right.
Eventually, we had a female instructor, a student who became an instructor and was teaching those classes. And the way she was behaving with the girl was completely different. And I was standing sometimes watching going, "Ooh, I wouldn't have done that. That is crazy. You're putting too much pressure." But they used to love it. It was different because it was a female showing them, look, that's the way. And she was good doing the techniques, performing, very aggressive, very fast and convincing. And they had this big club where they would go and, have coffees and eat some cake after. It was a small little family. And I was like, okay, it never happened with me because, I'm the guy there. So do you see that connection, of course, between the girls when it comes to have some sort of a leader that can answer questions and be practical and physical and things like that? Is that part of it?
Yeah, I think when that's available, it's a really, really great thing that can bring a lot of women in and kind of give them a sense of community. Because I know, like me in particular, my very first Krav class, you think I went by myself? I brought a friend, just like a lot of women do, because it's very intimidating. You see a bunch of, Neanderthal men beating on things.
Yeah, people with no hair, this kind of people. Yeah, I think, who the hell is that?
Your hair is beautiful, Joe.
Oh, yes.
But yeah, I think one of the largest battles in Krav Maga and self-defense is just getting women in the door. It's not necessarily about their ability level. Men and women have the same capability for violence and training and learning the techniques. It's just that we're socialized differently from birth. We're usually taught, just the more social piece of being caring and being kind and don't offend anyone and don't this and that, and little boys tend to be allowed to wrestle and that different side. Yeah, which is not a bad thing, but when something is taught from birth, you can't just turn it off for a class, right?
That's very
good. So when I started doing I had a really hard time trying to come up with women's only classes for a long time, because I got very stuck in women shouldn't have to train with just women. They should be training with who is likely to attack them, which statistically is men.
Right.
But I kept running into that wall of a lot of women were a little intimidated to come in. So, okay, fine. I'll set up an environment where they can at least get in the door.
Right.
And start that journey. And so my training with women has been different, not in what techniques I teach, because I would tell the women all the time, the techniques I teach you, I teach men too. What I'm bringing in is an environment where you're allowed to be violent and be aggressive for a higher good, but it's also to shift your mindset. Wow. The mindset with women is what is probably the biggest challenge. It's so possible and it shifts all the time, but women just need that ability and someone educated enough to allow it to happen.
Very interesting. That's it, because I've noticed that having this class, for instance, and saying that you're going to be training with another female instructor, you're going to be training with the girls who will be there to help you out there. So we got many females through the door. London, as you would imagine, it's a big melting pot. We have, apart from different nationality, different religions and things like that. So there was also a big factor. I'm only allowed to be with females. I cannot be touched by a male or so on. So that also helped a lot. But what I want from that females class from the beginning was just, as you said, a doorway. Come here, get a few sessions out of the way, and then eventually you realize that, these people are okay. Nobody is here to kill anybody. So some of them will, after a few sessions, will join the regular classes and, still training to this day after many years. Some others will continue training with the females only because they like that environment. It's nice, everybody's nice, and we get some stuff done. And then we go out and have some coffee after this, which is the best part of the day. We can talk. So that was also one. So in the beginning, I realized that it's not just the Krav Maga, it's the punching and kicking and doing all the crazy stuff, but the socializing, the whole atmosphere that goes with it, which I think is also part of the, the club, if you like it. So I guess it's pretty much what you're saying now.
Absolutely.
Wow. Okay. And some of them in the beginning was like, kick the guy in the groin. Oh, no. I was, never kicked anyone in the groin. It's not very natural. So, but after a few sessions, it become very natural. I can guarantee you that. And then literally after a couple of months, we're watching them again and go, oh, look at you. You're trying to stop kicking the groin now because you're going to kill the guy. So there was this big shift in mindset from I cannot do it into, hey, this is actually interesting. Let me carry on doing this.
Absolutely.
It's very interesting. So, okay, that's very nice. Because when men talk about this kind of stuff, it's very easy to get the label of, oh, come on, you're a man, you don't know the difference. But, from being a son, a father, a husband, and so on, you ended up learning something eventually, which is, I guess, is okay. Okay, very interesting. And the clinical psychologist, any specific reason why you went to that branch of psychology, or it just happened?
Why did I go to clinical psychology?
Yeah, because I know psychology is divided in many branches and different sectors and things like that.
Sure. Yeah. So you can go neuropsych, you can do forensic, you can focus on counseling. Clinical, at least in the United States, I can't speak for anybody else, but in the United States, clinical psychology is, it's pretty generalist, which is, there's such a beauty in that because you can learn a huge breadth of knowledge to be able to help a lot of different populations of people. But you can also not necessarily get pigeonholed either. So as a clinical psychologist, I can be, I can be a consultant, do assessments, do psychotherapy, work with different age groups. I can go in and basically work in teams of lots of different professions. I can do it in different sectors, civilian, military, government.
And
So
especially sports psychology, I guess, is big these days, huh?
Yeah, so I liked the flexibility and kind of freedom that came with clinical psychology, because I could kind of, play in different parts and, do really well with that.
Well, that's very interesting. Wow.
Yeah.
I mean, you finish your degree, you got your stuff. You at the time you were thinking about opening your own place, and I even joked, why don't you come and work in the UK? I'm sure the NHS will be looking at someone qualified as you, and we were talking about this. Did you actually have the time to get a business going at the time, or you joined the business we're going to be talking later, but not so much? And what was the setup initially?
So when you're in a doctorate program, every year you're in a different training rotation. So I worked in university counseling settings, a private practice, forensic settings. So I was working in prisons and somewhat near prisons in different aspects. So I got a really interesting number of years of playing with different just different areas of work. And then during my postdoc, my father was really sick, so I relocated back to hometown. And I had been in DC for years and years, so I didn't have much of a network in my hometown at all. So I had to do a lot of studying, get licensed there, which took time. And then I opened up a private practice where I was doing individual therapy with people, and I really enjoyed it. But I I guess I wasn't ready to settle down. So I ended up closing my practice almost 2 years later. And I work, I'll leave it as I'm a psychologist in the military.
Okay,
now.
yeah. That's interesting. So now I guess all the time you spend training, all the preparation, now you found a place where you can actually connect to that and use it as a, deep, I would say, plenty of it.
Yeah, it's I thought about the military for a long time, and it just, how timing goes. Timing allowed for it, and I come from a military family, so I don't know. I've always loved the different populations I've worked with. It's not that I didn't enjoy what I was doing before, but it was kind of now's your chance to be able to have the honor to treat soldiers. I don't really know too many things cooler than that. So,
and you have the preparation before a scenario, before a war, and you have the after. You have lots of fields you can work with that, I guess, isn't it? Especially talking about, I guess the psychology involved when it comes to train a special force group, for instance, it must be something out of the blue. So much information, and the way people act and react, and the fear and all those things that must play. It's a very interesting field. Fantastic. Yeah. Wow. Okay. And how do you see? I mean, we've been teaching classes in London. I mean, we celebrated 14 years. Yes.
Wow.
Running. Yeah. So we are getting old now. 14 years running this business here in the UK, and in central London, people from all over the world, all sorts of walks of life. People who came to the UK for a 6 weeks course, and actually 10 years later, the guy's still here because decided to stay. someone who moved, sold everything, he was supposed to be here for the rest of his life, and after 6 days, pack his bags and decide to go home. So we've seen it all. It's
Sure.
crazy. But what we saw in classes, for instance, what is it, that question? How does she use psychology in her Krav Maga training as an instructor? Oh, that's a very good one. So how do you use psychology in your Krav Maga training as an instructor? This is from Tibu, one of our main senior instructors in UK.
Oh, that's a super good and loaded question. I mean, no, it's a good one. I've never really come up with a perfect answer, but it's kind of like any, I guess, passion or career or profession or, you know, anything along those lines. Years and years of training and skill building in psychology. It's very hard for me to be a Krav instructor without that influence. It's part of me now. And I would be lying if I didn't say that Krav influenced my psychological skills as well. So it's been a really interesting, cool blend in my short career. But probably one of the biggest things I use in psychology is that ability to kind of stand back and get my ego out of the way and evaluate what's in front of me. So just like I would if somebody came and sat across from me in a therapy situation, it would be very, very unwise of me to start assuming a lot of things. I'm there to help them not only tell their story, but how to heal through their own skills, right? I'm not a magical wizard here. I don't heal people. I teach people how to heal themselves.
Right. Okay.
So in a Krav situation, if somebody, you know, is coming in and they're from a Taekwondo background and, you know, they have certain personality traits or whatever comes in the door, I use my clinical skills and step back and say, what does this person need from me? Instead of me going, I'm the instructor, you do as I say.
Yes.
Yeah.
We all been there. I mean, I've done that. I have my share of that one too. Yeah.
No, not you, Joe.
Oh yes, there's always that. And when you're a young instructor, like, yeah, this is the way Emi used to do it. My instructor taught me that. That's the end of it. There's no other way of getting out of this apart from this way. But then eventually you get older, you realize, like, no, that's just one way. There are another million ways of doing it. Yeah. Oh, it's very, very interesting. Remember what I was saying in the beginning, that people come to train for different reasons. And in the beginning, I used to teach everybody the same way. And then I realized that, no. What is that? What brings you here? You know, oh, someone attacked me yesterday. The guy did this, and I want a solution for that. Oh, you're looking for a solution. Okay, let me tell you more or less what the solution is. Maybe tomorrow you're not going to come back anymore because you got that solution from me and you think, now this will be enough for the future. If that happens again, you'll be able to use the same technique, but it's not the case. You need to carry on and continue doing this because there's no such a thing as one session, 3 hours training, and now I'm prepared to fight the world. No such a thing, isn't it? But anyway,
that would be very false advertising, yes.
Yeah, but people love the quick solution. It's very, very rare to see people, when you tell them it's going to take you 7 years to become a black belt. Ooh, 7 years is a lot of time. Can we do in 2 years? So like, what exactly do you want? You just want the belt? You can buy one. It's buy online. If you want to get the experience from the belt and go through every single hoop, have to experience everything, then 7 years time you'll be a black belt. I mean, you see this all the time. We are sometimes focused too much on a result. I want it, but what are the steps for you to get there? No, the steps, another story. I don't have the time for that.
Absolutely.
Very interesting. So, well, there's another question coming here. Question half jokingly. All right. So Maxim is half Israeli, so you have to take him with a bit of a joke. As a clinical psychologist, what would be your professional assessment of the key aspects of the Israeli mindset? What did I tell you? See, I can answer that one, Maxim, but you don't want to hear from me, yeah?
I have no comment.
No, we interview some of the Israelis, and we keep joking that the way they talk is always as they've been interviewed, not interviewed, but been interrogated. It's always this, have to think about the answer and I'll give an answer. It's always a yes or no or maybe. So it's quite funny. But I like the mindset.
I had someone ask me when I got back from Israel a couple years ago when we had that camp, I had people asking, especially from the Midwest, you know, what are Israeli people like? I've never met anyone from Israel. I said the best way I can describe the Israelis I met is simultaneously they are the most aggressive and loving people
Yes,
that
exactly.
you'll meet
Yes.
at
Yeah,
the same time.
when you don't know them, they are very like much like that. And then after you get to know them, there's a completely different side of it, which is,
Oh,
yeah, if you can see through that,
yeah.
it's good. Another question here from Anna. It says, are you using cognitive behavior therapy principles in your practice or in training? If that makes any
Am I
sense. Cognitive behavior
am I
therapy.
using CBT in training?
Yeah, in your practice as a psychologist and also in training.
Oh, yeah. I mean, so the way cognitive behavioral therapy is kind of viewed in the psychology world is it's kind of it's foundational and textbook at this point. It can't be ignored because it's so evidence-based. So
Right.
there's a lot of really wonderful things that come from CBT. If you talk to a lot of psychologists, at least ones that I know, very rarely is it used purely. It's usually people are bringing in skills and techniques from other theoretical backgrounds.
Right.
But yeah, I think in a Krav training, CBT would be used a lot. Yeah.
A lot. Okay.
Yeah.
Yeah, because well, when I started training and teaching, that was like psychology, 1 degree, that was it. And then along the years, they start moving into NLP and CBT, and then the what's it called, the neuroscience, and they start branching out slowly. So, but at the end of the day, it's pretty much one big cloud of knowledge, and you know, trying to understand us, the human beings, the crazy people. There's one here. By the sounds of it, you treat and help soldiers. Any advice or suggestion you can give to all of us non-military with this anxiety times now that we are going through here? So he's an instructor. Edward is an instructor, and of course, people have been sitting at home for like what six weeks now in the UK, and as far as we can see, will be at least another 3 to 4 weeks before people are allowed in the street. So of course,
Yeah.
there's a lot of anxiety, lack of people lost jobs, and people are locked up at home with family members and kids and dogs and all the stories. So what do you reckon on this?
So, I mean, we've been talking about that here as well, not just on the civilian side, but military side, and whether you're military, civilian, government, it doesn't matter. It's affecting absolutely everybody. And there is no easy answer. What I've been talking about with other providers, though, is not that this is a catch-all, fix-all type of piece of advice, but it's a mindset, right? So I would imagine everybody who is viewing this Zoom meeting is probably associated with Krav in some way. Is that fair?
Yes. Yeah, we have here people which actually work as what's it called, social my God, what's the name of that, social workers, let's put it this way. Let me try to keep it simple here, because I'm way out of my depth here with talking about this kind of stuff.
So yeah, but anyways, something I was talking about with other providers and like occupational therapists, psychologists, social workers, anything along those lines, if you're looking to help people in a really interesting time that we're in, where basically most of our freedoms and our sense of control is kind of out the window, is what it feels like.
Taken away, yes.
Yeah, so the biggest skill I think people can practice, and if you're already into how should I put it, into the Krav lifestyle, or you buy into the principles of Krav, one of the things is adaptability, right? So, I'm not trying to digress here, but we've talked about this before. If anyone thinks Krav Maga is one specific list of techniques and no others are allowed to be practiced or learned, you're missing the point.
Yeah.
The idea is to be able to adapt to a certain set of principles. And so that's where I kind of look at it in an environment where I'm stuck inside, whether I lost my job or not. I'm either stuck around the same people all day, every day, or I'm all by myself. Because people are in all different sorts of scenarios here, is the only thing you're really, really able to do is focus on what you can control, right? So like in Krav, you don't get to pick your attacker. Yeah. It's, if that were the case, then none of us would ever have to fight again. But you have to be able to adapt as soon as you recognize what the factors are, right? So if you're not able to go to your fancy, beautiful gym, that was your main source of self-care, which I appreciate, because I can't go hit a heavy bag. I can't go do any of that stuff either. And I miss it so much. But I have a choice here, right? So do I obsess and get upset over this, or do I watch Krav videos like you put on Zoom classes? Do I work on my running and get my cardio back up so that when the gyms do open up, you know, I'm not completely starting from ground zero? Maybe I work on calisthenics and get my push-ups going again. Maybe I learn how to cook with the food that I'm able to get in my kitchen. Right. It's just, and I'm just putting out very small examples, but it's the concept of, it's not one exact thing you can do in order to get through the anxiety of this time. It's being able to be flexible to what is available to you, what you can control.
Excellent. Yeah. Adapt and overcome. I like that. That idea. You know, you fight. The Israelis have a saying, which in Hebrew sounds much nicer, but it's pretty much that we have to fight with the tools we have, and we need to win the war. So then, you know, the pressure bit comes at the end. So we have to fight what we've got, but we have to win. So it's simple as that. There's no going backwards. Yeah, this is one of the things people have been focusing on, making breads, and you know, I painted the fence almost twice. My God.
In your Breaking Bad suit.
My breaking, yeah, I call it painting bed, yeah, because, you know, more like, and you know, doing other things around the house and spending time doing other stuff. And in my case, I've been training with my kid for the last few days, last few weeks. So it's stuff that in a normal environment it wouldn't happen, because in the evenings I was teaching classes. So you know, I'm seeing this from a completely different point of view, that I'm gaining something instead of losing something. Even though we might not have a business to go back when all this is back to normal. But hey, we're going to do something else, work with something else until we can get to that opportunity where we can reestablish the business and carry on. This is not going to die. It's been 15 years. Yeah, come on.
And if I had to add something to that, this was something me and the other providers were talking about. We all had to come up with some tips. And, you know, on the psychology side of things, especially the therapist in me, people kind of roll their eyes when therapists say things like this, but it's actually a very logical approach, is being able to really practice not judging your experience and having compassion for yourself. So like whether you're military, civilian, whatever, there's a lot of people who are experiencing higher levels of depression and anxiety because they're judging how they're not adapting well to this pandemic and being in quarantine, and just kind of feeling like they're not doing a good enough job, I don't know, being a human. But one of the things we were talking about over here is that mindset is not helpful at all. It only causes more suffering. And what you need to understand is, if you're experiencing that, the likelihood of the majority of the population experiencing it is very high. Yeah. So to be able to, when you catch yourself in this pandemic, getting really down on yourself, whether it's for not exercising enough, which I do the same thing, I get down on myself for stuff like that. And then, you know what, if you need a cry session, if you need to go sprint until you're out of breath, you do whatever it is, and you let it pass, because it's not permanent unless you allow it to be. So
Very
that
interesting.
mindset, and just having that, it's, as we say in a therapy world, you know, when you're in your pretty little office, you know, you got to talk to yourself the way you would talk to a good friend.
Very interesting. That's a good
Yeah.
point. Oh, yeah, make a note of that one. That's an interesting. Yeah, very good. Very good. Yeah, yeah, yeah. You know, sometimes we look for very complicated solutions for problems that, you know, a sentence like this is, that's it. That was it. I was expecting, you know, big book, this thick, I had to go through, but no. A sentence like that will do the job, which is very good. I've got a question here. How have you applied what you've learned as a clinical psychologist to Krav Maga in practice? For example, how the brain operates in coping with stressful situations. I mean, could you use any of that as a lab with the students, perhaps? Or?
Oh man, you're gonna bring out the nerdy side.
In very lame terms, please. Don't make it too complicated. Huh?
Yeah, I have to read my neuropsych stuff very slowly and with highlighters and crayons because it gets.
Yeah, that's me. Talking about me.
You have the best crayons, don't you?
Yeah.
So when it comes to clinical psychology, in particular neuropsychology, do I use that in Krav? Absolutely. So when you're talking about, everybody has heard of the fight or flight response. The one thing a lot of people don't end up talking about is it's not just the fight or flight system, it's fight, flight, freeze.
Okay.
Right? And when you're talking about being a Krav Maga instructor, I mean, there's no way you haven't seen this, Joe. You have the students who kind of go ape, and they get a little too carried away, so that you can tell that their fight system has kicked on because they have been triggered by a certain amount of stress in the classroom, whatever it was, which is what those exercises are for.
Yeah.
But there's a lot of people, it tends to be more so on the female side, not because it's a female only experience, but just because of other aspects. A lot of people just kind of stop and they freeze and they don't know what to do. That has nothing to do with people being wussy, weak, anything like that. That's the brain taking over when it doesn't know what to do and it's experiencing such a severe amount of stress that, you know, everything starts to kind of shut down.
All right.
And I went to, I'll never forget this. I think it was a training on this actual thing, and I loved the analogy that the lecturer gave was, so if we think about fight, flight, freeze in terms of like animal kingdom, so we'll use the whole gazelle lion piece. Okay. Hopefully I'm geographically getting those animals right. So a gazelle sees that a lion has caught their line of sight, and that lion's going to come for its dinner, right? So in that moment, once that's recognized, the gazelle has two active choices. And I mean active as in it's a voluntary choice. Right. They either start running for their lives, or they fight, right? Right. Well, in terms of gazelle versus lion, probably not going to fight, so they're probably going to take off. What happens when the lion comes and bites them in the neck and they can't run or fight anymore? That's when freeze kicks on. Right. So freeze can kind of be looked at as the dual purpose thing. It's kind of like the playing possum. Right. So if I'm still, maybe the attack will stop. And the other way it was put to me, which kind of blew us all away, is it's the brain's kindness of making death less painful. It's like, okay, that's it, I'm ready. Yeah. Yep. And so this, you know, to bring it into Krav, like, so for example, when I've worked with women, freeze response comes up a lot. Right. So for the clinical side, when I'm teaching women and we go over any groundwork, for example, or choke against the wall, we're talking about a bit more of a realistic common scenario for like sexual assault against women. And I've had a lot of women, they just freeze and they're done. They're like, I'm done, I'm out of here, I'm not doing this anymore. Yes.
The
Well,
trigger that triggers some memories or whatever it was that they never told you initially in your health questionnaire, was it?
right. So, you know, taking my clinical knowledge of how flashbacks work, how trauma works, long-term versus short-term memory, the stress response kicking on, all of that kind of stuff, my approach with the individual becomes a bit more nuanced. Whereas when I've been in classes before, and you know, this is not to put down any instructor I've worked with where this has happened, this is just lack of knowledge and education. Is I've seen women go into full-blown flashbacks, fetal position on the ground, and
Wow.
the instructor's like, come on, get up, come on.
Stop being lazy. Yeah,
Yes.
get up, you there.
Yes. And I have to go, get out of the room.
Yeah.
I will attend to them, and just using some of the clinical skills to get them out of that flashback and back to the present moment. But
Wow.
So I would say maybe like the approach and the pacing of how I communicate with students in the past is where my clinical skills would kind of come through.
Yeah.
Because without those, you can kind of easily get into, you know, boot camp instructor mode of, you know, don't be a wussy, keep going.
Keep going.
And that's not helpful. That's what runs students out.
You attach this wonderful PhD on top of a very nice instructor certification, you see? I'm just kidding. Not every psychologist is a Krav Maga instructor, but every Krav Maga instructor should be a psychologist in a way. Huh? What you describe about people freaking out and you know, imagine that is the end of the world, they need to kill somebody. We had this in class many times in London, and unfortunately, 99% of the times we were females, which never mentioned that, you know, I had a situation in the past. Here I am to train Krav Maga because I want to try to maybe prevent or future or treat that. But my point has always been like, look, we are not trained psychologists. We teach Krav Maga. If you need help from someone, perhaps not the physical self-defense, not putting someone in a, you know, when you're on the floor sitting on you and trying to punch you in the head, to let's revive the scenario and teach you how it goes, because that's going to take you to a completely different place, which is not exactly what you're doing. And when we had that a few times, and my approach, unfortunately, was to, you know, contact the person and say, look, as much as we want to teach you this, but we are not qualified to deal with the problem. So I would suggest you to stop training Krav Maga and find a psychologist or psychiatrist or whatever that is that can give you proper help. Once you are in a position where now I can do the physical stuff, then we can coordinate with the psychiatrist, psychologist, and then eventually get you back and train again. But the problem is that having a class with one person that is a completely time bomb, that you don't know exactly when this will happen, at what stage, and have another 25, 30 people there that, you know, can manage the situation was always complicated. And, you know, people call me selfish in the beginning. Oh, you don't care about this person. I said, I do care, but I have another 25 guys there, boys and girls that, you know, are training, and they want to see perhaps the training. So let's put this person to the side. Let's chat and focus in giving, you know, the person some help, but not via training.
Right.
This will be a ideal solution for our case, or was that a wrong way of dealing with it?
No, I mean, when you have a group full of people, there's only so much you can do. You have to go based off of what you're competent in, and you are demonstrating competency by knowing what you're not, you know, educated in necessarily, right? Like, like when that woman dropped in a fetal position and I saw she was literally in a flashback that was triggered by a stress drill, I knew what to do to get her back. That's because I was trained to do that.
Yes.
And, you know, if you're not trained to do that, you should at least at the very minimum know who is, and you send them that way.
It's like a first aider, so we know who someone, you know, break a fingernail, who goes then applies the plaster there. So that, okay, so we should have all psychologists and stand by in a class perhaps. That would be a good way of saying this in the future.
That's going to be a very expensive consultant for you.
Yeah. Your microphone, I don't know if it's you or me, but hold on a second. Something, is everybody hearing okay? Yeah? Okay, then maybe it's just me there. I don't know exactly what happened. I've got a question here. Yeah. Okay. Looks okay. don't know what happened to my thing. Let me just get the volume up again. Ah, can you say something? I think. Yeah. Can you hear me?
Yep. Yep.
The volume is back up again. We've got questions. Someone wants to ask a question directly. Can she? It's a bit too long to type the question. She wants to use the microphone. Can she?
Absolutely.
Hey, Lucy, go on then. Let me, whatever I need to do here to get you out of this thing.
I think I did it already. Thank you. Hi, Megan. Thank you so much for taking the time. I've been training with Joe for just over a year now. I am absolutely not trained in psychology at all, just a total quack, something I've been interested in my own personal development since I was 21, so about 7 years now. Something I've always found difficult is this ability to kick in with, like you said, the mindset. So go straight into the anger, which may be more easy for males, and instead of getting sad and feeling guilt, so feeling anger and wanting to fight. And I know you mentioned it before, so I wanted to ask you what your biggest learnings are from kind of studying it and also in craft. Thanks.
Yeah, thank you.
Yeah.
So I'm smiling because as soon as she mentioned how do you go straight into the anger, I immediately thought of the Hulk.
Yeah, Hulk smash, bang.
Just need to Hulk out, exactly. None of this guilt, sadness stuff, revenge.
Well, if you saw the original Avengers movie, I'm exposing my dork right now. But you know that part where Captain America is like, now's the time for you to get angry. It's time to go. And he says something along the lines of, that's my secret. I'm always angry. Right. So I look at it as it's a training not only of mindset, but of your nervous system as well. Right. So to be able to bring about that nervous stress response is really difficult. It's something that we actually try to avoid, right? Because it's exhausting, it's painful, it's all those things. So one of the ways, and this might sound a little funny, but one of the ways I have viewed my training in the past is kind of like a mindfulness training. I don't know if that sounds odd, but when it's time to go, you just have to really start to look at how your approach is towards it, right? So I do know some of my training colleagues who are like, yeah, I get angry, I'm in a rage. That's not necessarily always the best answer though, because one of the things that we do know about anger is we don't make good decisions when we're angry, right? It's those chemicals that start to flood our body give us the energy to do the thing we need to do, but it doesn't automatically give us the right answer. Right. So we have to train in that emotional state in order to actually be able to get that technique out, right? So for example, I love your question because it's something that for years I've been very uncomfortable with. Very when people say it's multiple attacker time, it's sparring time rounds, oh damn it, I don't enjoy punching my friends in the face.
Only Paul.
Or sometimes you're just not feeling it, so sometimes I just shout at them so they don't even come near me because I'm like, I just don't feel like punching today.
Well, and see, that's something, I'm glad you said that too, because when it comes to, it's kind of like what Joe and I were talking about earlier on in the conversation, is you don't get to choose your attacker. You don't get to choose your attack scenario. There's only so much you get to choose. But what you get to choose is your training skill set, right? So if you are super uncomfortable even being reserved, right? So I'll kind of keep this on the female side of things. There is a very high level instructor in the US by the name of Kelly with Krav Maga Worldwide. I haven't been to her seminars myself, but I saw a video of one and she was amazing. And she started her seminar out with, what is the typical response when there's a group of women and someone goes, where do you want to eat?
Right.
And everybody's like, I don't care, wherever you want. I don't care, whatever you want. Please don't make me decide, right? And she says in this video, she's like, if you can't even put some confidence in where you want to eat food,
yeah.
What are you gonna do when someone physically attacks you? Like, there's different levels of this confidence of being able to handle yourself, and it's not just physically throwing a punch, right? It's boundary setting from an initial emotional point of view.
Wow.
So to get back to your original question is like, if you need to be angry, all right, you need to really examine what makes you angry. Right. And I've had to do that with certain female students where they kind of come in and they're kind of in denial of, well, I don't really need to do the self-defense training because my husband's a cop, and you know, I'll never be, you know, sexually assaulted, and I'll never be this. And I have to kind of flip the script and find what makes them angry or fearful, or what would actually kick in that need to survive. And everybody has to know what that is.
Very interesting.
Does that make sense?
Yeah. When I'm using classes, for instance, when we are training, because we used to teach classes in central London, very close to where we had many attacks and people got stabbed and killed. And during the class, everybody's, you know, jolly, laughing, joking about, says, okay, let's change this. I want to imagine you're going to leave this class and 20 minutes down the road, someone is going to pull a knife and try to hit somebody or kill you. So how would you, you know, I wanted to put yourself into that perspective. You're right there, right now. How would you act? And then you see them punching those pads like they're going to kill, you know, the level of aggression, the energy goes up so much, so high, everybody stops laughing, they focus. And it's like, okay. So I like to play with that kind of a mood in the class. How would you defend your little brother? How would you defend your little sister? I want that kind of attitude now when it comes to training, because then you'll be very close to what is the reality one day when you need to use it. You know how to get there. Yeah. And the other thing we do, for instance, I don't allow any white and yellow belts to spar in class, for instance, because as I normally tell them, we don't know how crazy you are. We don't know the little lunatic that lives inside you. I want to get to know that person slowly. And then by orange belt, when you have like, you know, X number of classes already, you've done all the striking, we know how to deal with you, that you respond to commands, and I know what to, you know, you're the kind of person who likes a joke or will have to be serious with you all the time. Then after that, we can start sparring, but then it's more controlled. And every now and then, you have the nice guy that, you know, is very gentle, but then all of a sudden you put a pair of boxing gloves and turn into a freaking lunatic. And you know what I'm talking about.
Yes, I do. Yeah.
You know, it's how to control. You go with that guy because the two of you are crazy. You understand one another. So you go with that one because you like to beat people up, but you don't get to get beaten up back on again. So, you know, there's always this mind games you have to play in class when you are teaching. As I call it, we are the father of many kids. You know them all. This one, that one, he likes his way. So it's very interesting to play with all that. But I've got another question. A current question, what is more useful, getting angry and aggressive or remain calm but focused in what you're doing?
What was the beginning of the question?
What is more useful, or getting angry and aggressive in a situation of self-defense or remain calm and focused?
Is that a rhetorical question?
Most likely, yeah. It's,
yeah, calm and focused. And I think, you know, like what Lucy was talking about with getting angry in a class setting is that's part of what has been a challenge in my training. Like I was talking about, is I was so uncomfortable bringing that aggressive, angry state out because, yeah, it is just that. It's uncomfortable, right? Like, how crazy do we all appear to the rest of the public that we, you know, pay fees to go do this stuff?
You go crazy, yeah.
Right? But what you're doing by practicing that anger through physical practices over and over and over again,
yeah.
When you start to see success in those things, what you're really doing is retraining your brain and how you utilize that anger, though. Right. So it's not the same anger you started out with, where it's unregulated and without its technique and experience and skill level. now, you know, like I know you said with Paul. So one of my most interesting experiences at my brown belt test with Paul, by the way, he started it all. So if he
I know, he deserved it. He deserved it. Yeah, I'm sure.
No, he was.
The Paul that we're talking about is Paul Smith, the one we interviewed the other day. So yeah, keep going.
So he was one of the instructors that was grading me during my brown belt, but he was also very active with all of us on the floor, and he was initiating a lot of the attacks, and he was sparring with us, and you know, he was just very involved. And there was one instance where I literally couldn't remember what happened. I had to talk with my friend Jen, and I had to just let some time pass before I realized what happened, because it was such an initial instinctual reaction. Is earlier on, I don't know if it was earlier on that day or the day before, I can't remember, but they brought out the shock knives, and he got me in the inner thigh, and that shit hurts. That hurts. But you know, it was so scary because I'd never worked with shock knives before. The pain was so great. Yeah, I was pissed. Yeah. I was pissed, not at Paul, but just I'm like, I'm so angry that it was happening and that I, you know, didn't do the perfect technique to avoid it. And the next day or later that day, whatever it was, I was doing some sort of technique work with someone, and I heard that click, right. And I turned around and did what you're not supposed to do. And I low round kicked him in the knee, and he dropped. Because I didn't go straight into pure anger. I went into what's worked for me before. Yeah. And that initial stress response, because that's how I've trained through that. Right. That's what I did. Right. It worked. Yeah, and yeah, it worked. He can tell you that one. I'm sure he'll remember that one. Yeah. Yeah, Paul was absolutely fantastic. He gave me a lot of bruises though. The bully, yeah. Yeah.
Listen, we have more questions, but the problem is we out of time. It's as I say, when you're having fun, time tends to disappear. Of course, we have a couple of minutes to go. If you have to ask a question, mute yourself and ask the question, but be gentle, okay? Be nice. They think everybody here speaks like the Queen, but be nice, huh? In the meanwhile, so I would thank you very much for the time. You've been fantastic. I mean, I didn't have a frame or questions, a list of questions, because I don't believe in this kind of stuff. I like to relax and let things just flow. But for now, thank you very much. I appreciate for that. I'm sure we could talk for another few hours about different stuff and compare notes and stuff like that. For what I tell everybody when we are having these interviews is sometimes the guest will say something that will connect with you. As like, okay, that's a very good point. I can use that. And as a Krav Maga instructor, we are constantly stealing things from other people, from other instructors that we can actually use back in the class. Because at the end of the day, there's a big lab where we need to try different tools and different ways of experimenting to get one result, which is one result only, which is get people to improve and become better on a psychological way or physical way, or perhaps in a more technical and tactical and all that we talk about.
Absolutely.
But so I have a question for you now. Just answer yes or no. How does the boys react when you show up in your uniform and you got the big doctor and the big I'm the officer? I guess the guys will go like, oops, I don't even know how to act them. Is it? Do they scare them?
So when you're in the military and you have an officer rank and you're not an officer, you just kind of snap to attention regardless. It doesn't really. They just see the rank and they want to behave appropriately.
Oh. And in a civilian world, also, I guess, when you tell anyone that you're military and you're an officer and with all the degrees, the bells and the whistles, and I guess the boys will have to take 3 steps back and go, whoa, 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 let me approach it slowly.
What boys? Where
okay, I'm just saying. Okay, nice one. Well, listen, thank you very much once again. I appreciate
Oh,
it. I hope this thing will go away soon. We can start getting on the planes and traveling to different places. And of course, gonna try to drag you to the UK one of these days if we can.
Yeah.
Yeah, or we take some people to the US. I don't know which one is it. Or we meet in Israel and we'll find a way.
It's a short flight for you to Israel. For me, from the West Coast to the US,
It's a long way. I know. You guys
that's a
have
hell of a trip. Yeah.
a lot. Yeah, we used to go to the moon, then actually travel to the other side of the world, isn't it?
Let's just go meet Danilo in Italy so we can eat.
Well,
Just
that's
that's-
yeah,
yeah.
that's the deal. Sure, we can do that. I miss Italy. The best of Italy is I have a little basil tree on my window every day. My daughter and I go there. We smell the basil.
There you go.
It's so funny. It says this is the smell of Italy. Okay, one of these days you're gonna go back.
There you go.
My son, thank you very much. Appreciate it. Thanks for the time.
Thank you.
Thank you, Megan. You're great.
Thanks.
Thank you.
Bye.
Bye, guys.
Thanks, Megan.
Thank you.